In this section, we want to continue looking at cell division, specifically looking at how the cell cycle is regulated and the difference in the 3 checkpoints of the cell cycle. You will recall that we said a tumor is basically a cell division that goes unregulated. And so really quickly, how do we regulate then the cell cycle? Well, first off, your cells halt at what we call checkpoints that occur in this cell cycle, and there's a checkpoint after every major event of the cell cycle. If you look on page 117, I'll show you the image in just a moment, but at each checkpoint there are proteins present, and the job of the proteins is to determine the condition of the cell. Cell must pass the checkpoints to proceed through the cell division. If they pass, that means that the condition of the cell is normal. Now, these 3 checkpoints are located, if you'll notice, there's one at the end of G1, there's one at the end of G2, and one in the middle of mitosis. So at the end of G1, the questions that are asked by these proteins at the checkpoint is, first off, is cell division necessary? Is this a cell that needs to divide? And 2, is the cell large enough for G2? So has the cell grown enough to move on to the next step? And so if the answer to these questions is no, then the cell is not allowed to proceed. However, if the answer to the questions is yes, the cell goes into the S phase, it then goes into the G2 phase, and at the end of G2, again, those proteins stop the cell and they ask a question. The question here, was DNA replicated correctly? Is all the DNA copied? Was it copied correctly? Again, if the answer is no, then the cell is not allowed to proceed. If the answer to the question is yes, then it moves on to mitosis. And remember, mitosis has 4 phases: prophase, then metaphase. Well, at the end of metaphase, there's a checkpoint before the cell can progress through anaphase and telophase. The proteins ask, are all the chromosomes attached to microtubules? So has each chromosome become attached to these filaments? Have they moved to the middle? And is everything equal there? If the answer is yes, then they progress through the rest of mitosis through cytokinesis, and the cell splits in half. So this is kind of how we regulate the cell cycle. Now, they do mention a little bit in the text, again, about cancer, that these would be that tumors are these unregulated cell divisions. And so these can lead to mutations, and some of these mutations we know can lead to cancer. However, one of the things that it mentions in the textbooks is that most of these mutant cell cycle control genes, there are only a few of them that are actually inherited. Instead, most of the risk of cancer is actually being contributed to exposure to environmental risk factors. And so this is typically the reason why we see cancer in older people more often than in younger people, because they've lived a lot longer, so they've been exposed to a lot more carcinogens, and so because of that, they have an increased likelihood of developing cancer. So one of the things that it mentions in the text is, as far as cancer detection is concerned, early detection obviously increases your chances of survival. So what they say that you should actually be using is the caution method. So the C in caution, looking for change in bowel or bladder habits. So do you see a change in bowel movements, a change in bladder? How often are you having to urinate? How often are you having to defecate? Is there a big change in what's actually being excreted? The A, for a sore that does not heal. Do you have a bruise that doesn't go away? Or do you have a mass that is sore, or an ulcer that just will not heal? The U, do you have an unusual bleeding or discharge? T, is there a thickening or a lump, for example for breast cancer? I, indigestion or difficulty swallowing. O, obvious change in a wart or a mole. N, is there a nagging cough? Is there nagging hoarseness that just will not go away? And so if the answer to any of these is yes, for an extended period of time, then it might be something that you want to go and have checked out, because again, early detection obviously increases your chances of survival. So we talk about treatment. One of the most common forms of treating cancer is chemotherapy. The image to the right is Lance Armstrong. I mentioned him in a previous section. He was the cyclist. He had testicular cancer, and they use chemotherapy to treat him. This is where they take chemicals that selectively kill dividing cells. So it's a combination of different drugs that are used, and the whole purpose in these drugs is to interrupt cell division. because we know that tumors are caused by unregulated cell division. So it keeps the cells from dividing. It helps prevent resistance to the drugs. Normal dividing cells, though, are also killed. So this is why a lot of times people that are undergoing chemotherapy, they're going to lose their hair because the hair cells that are dividing, they get killed. It can cause problems in bone marrow. It can also kill the lining of your stomach, which can cause a lot of sickness that's associated with the chemotherapy. Another form of treatment we hear of with cancer is radiation. Radiation just uses high energy particles to destroy cancer cells. And what it does is it damages the DNA of the cancer cells that prevents them from dividing. It's usually for cancers that are close to the surface, and it usually occurs after surgical removal of the tumor. So what they would typically do is remove it and then do radiation to kill anything that may have been left behind.